Hello and welcome back to Psychology 300. I'm Dr. Williams and this is Research Methods in Psychology. This lecture is one in a series for over Chapter 11 in your textbooks, Single Case, Quasi-Experimental, and Developmental Research. This lecture is going to focus on changing criterion designs, and it is a lecture for Chapter 11F. Excuse me. Okay, so changing criterion designs. Sometimes when you're conducting single subject research, when you have an individual with whom you're working, the final target goal is too big of a leap for your subject to go from where they are at baseline to the level of final performance. It's just too big for the subject to do in one single go. Of course, the one I think of first is smoking cessation. We call it going cold turkey, and a lot of people try and fail. So sometimes it's better to employ a series of pre-planned gradual steps that will facilitate a gradual shift toward that final goal. It's really useful for academic behaviors. In fact, that sort of spiral curriculum stepping up process is typical of many academic instructional methods. Medical regimens, exercise regimens where you gradually build up to the final goal. Things like smoking, quitting smoking, or reducing your caffeine are good examples. The characteristics of the changing criterion design are important. The most unique feature of the changing criterion design is the use of several phases or several steps. So it does once again follow an a basic A-B design, which I know we had talked about as being flawed, but remember that once you start using A, B1, B2, B3, B4, each time you move from one treatment phase to the next, you are again rejecting the null hypothesis repeatedly over and over and over again. So that's a unique characteristic of this particular design. There's no return to baseline required. It's good for behavioral changes that require stepwise change rather than 100% change immediately. The same treatment is used each time you alter your B-level treatment. Typically what we do is the criterion that is raised, so the minimum or maximum amount of behavior is changed in a stepwise fashion, and people have to either behave above or below that criterion. At each phase, the criterion is established, and if the criterion is met, then a consequence is given. So they earn reinforcers for meeting their goals, and they may have positive or negative punishers that they have to engage in if they don't meet their goal. So here's a diagram of kind of a hypothetical changing criterion design. So you have days across the bottom. You have frequency of behavior on your y-axis. And so the A phase of this basic A-B design, the A phase is baseline. You'll see that in this case the behavior is very low. And then when we begin treatment, that dotted line, when we begin treatment, each one of these steps represents a different phase of your independent variable or your treatment, or each one is a B. So I'm going to use my cursor here. So you would have, this would be B1 here, then you would move to B2, and then B3, and here's B4. And so now the goal is you set a criterion, and so you see these daily criterion lines that are set for those days, and here after 5 days, the criterion is raised. Notice that the criterion are not raised in equal increments. It is the case in this example that every single phase lasts for 5 days, but that also can be varied. For example, you might vary them from 4 to 6 days so that there's an average of 5 days in each treatment condition, or you might want to wait until you see some stability of the behavior, and that would signal a good time to change to the next level. Okay, so here's another example. This is an example out of a speech therapy intervention dealing with the loudness with which an individual is speaking so that you can be heard. There are a number of conditions where people's voices become very weak, and so these are attempts to raise the decibel level of speech. So you notice the first 4 days is baseline, and on day 5, they now set a criterion level that is right above maybe the mean of baseline. And the goal is for the person to speak for the next 3 days above that. And then at that point, they raise the criterion. And each step as we go, here I'll use my cursor. So here's B1, B being the treatment phase, B1, B2, B3, B4, and all the way up. And you'll notice that this individual does not achieve the target every single day. Sometimes they're below the target. So this would be a case for example, in our classroom intervention of when the data points fall above the line, they earn reinforcers, and when the data points fall below the line, they would have to reach into their punishment bag and get a positive or negative punisher. So the treatment for loudness on the production of words continues until they get up to about around 72 decibels. And then they begin increasing the goal, not by increasing the loudness, but by increasing the number of words required. So they move to sentences, and then they move to questions asked by several people. And then they move it into a new environment, into a classroom, and then they have maintenance and follow-up. And so once they achieve about 72 decibels in speech loudness, they then start generalizing that behavior to longer sentences and to multiple teachers and different individuals, as well as across settings. And so this is a very nice demonstration, and I like how realistic it looks. I mean, there's days when they're too low and days when they're above, and so it really shows you how this behavior clearly isn't going to happen overnight. It takes them 50 sessions before they finally, between 45 and 50 sessions, to get up to the target goal of around 72 decibels. It's a good example. Here's another example. This is the number of cigarettes smoked. So you've got somewhere between, at baseline, around, 18 cigarettes on average smoked per day for the first week. And then I'll use my cursor here. So here's all of our baseline data. And then the treatment criteria are the number of cigarettes allowed each day. And that tends to drop off. So note the dotted lines. So here's your target. And then the data points are either on the target or below it. The second day drops to, it looks like, about 14. And on the second day, it looks as though they maximize their 14 cigarettes that day, every single day. When they step down to 12, notice that here the data are now again below that line, and in every case for this individual, their bad bags must be really, really bad because they don't want to go into their bad bags. So they're earning their reinforcers, and the highest they ever get at any phase until you get out to about 28 days is that they stay at target at target or below every single day. When we get out here to 28 days, here's their target right here, and notice they have one data point, and they never do it again. So you see it drop, and then finally it all drops out, and then we've got 4 days of no smoking whatsoever. So really good example of what a changing criterion graph should look like. The changing criterion design requires very careful planning, and there are 3 really important features. There are the number of changes that you will have in order to reach your target. That's one factor. There's the size of the criterion change. So how big will the change be from one step to the next step? And then finally, how long will the phases last? And each of these 3 components are interrelated with the other 3 components. This is particularly true if you have a limited time within which to complete the entire intervention, as you might in a school setting where you have only until the end of the school year, and so you have to take time into consideration as well. So I'm going to back up a slide so that you can take a look, and we'll talk about these three features. So let's go back here to the cigarette example. If your goal is to go from 18 cigarettes here all the way down to 0 in 40 days, then within that 40-day period, you have to determine how long you're going to collect baseline. You also need to determine how many steps is reasonable. And remember, with cigarettes, what's too big of a step? Here it looks like they're going down about 2 or 3 cigarettes a day, not more than that. And so that's going to determine how many steps until you get out to 40. And so the number of steps, 1, 2, 3, 4, 5, 6, 7, 8, and then finally 9. 9 steps over 33 days here. And so that will tell you how, if you divide 33 by 9, you'll come up with approximately how big each step needs to be. And so you have let's go back to this one. The number of changes, the size of the change. Now let's go back here. Now these are all pretty equal, and we said it looks like they're going about 2 cigarettes a day, about 2 cigarettes a day. However, you could go 3, and then on another day you may only go down 1, so you can have a little bit of variability, but you have to ultimately make sure that it all fits within your time frame. And then of course the final one is the phase length. How long will they last? How many days can you stay at each level and not go beyond your total 40-day treatment or whatever the treatment is? When you don't have a goal, when you don't have a total treatment timeline that has an end date, then the phase length can be based on stability at each level. But if you have an end date that is set, and often it is when it's set by insurance or by school year or whatever, then you need to deal with that. Here are some good rules of thumb. Longer phases lead to greater stability, but they do take time. Fewer phases, you'll need better stability in order to demonstrate efficacy and not move forward too fast. And large step sizes, when you make changes in the step size that are really big, they may not allow lots of phases because you're going to get to your final goal sooner. And we really want to have multiple phases so that we can demonstrate the rejection of the null hypothesis over and over with each phase change. What's the ideal step size? It's tough. It's going to change for every person. If it's too big, that can be a problem. If it's too small, it can be a problem. So you want to leave enough room for that you have enough replications. You want it, if they're too big, it's hard to show that you have experimental control. They may not succeed. We talk about good instructional practice, and if it's too big, it may not fit with good instructional practice. And if it leads to failure, your subject may drop out. So you don't want them to be too big, but you also don't want them to be so small that the individual gets tired of waiting for the next change. The changes, they may not realize that there's been a big change. The behavior change may not really be detectable or be meaningful. And again, if it's too small, it could conflict with good instructional practice. Few limitations. You see improvements, but they're not connected to the specific criterion changes. That can be a problem. They could be due to extraneous variables or reactivity or self-observation. The changing criterion design is used a lot less in the literature than the multiple baseline. It requires a lot of planning and a lot of sophistication if the changes to the program are needed mid-treatment. So if your overall time to treatment is constrained, you might compromise your whole overall goal, and that can be a bit of a problem. Okay, so good advice. It's okay to estimate step size and length, but don't set them in stone. I mean, the more flexible it is and the more unpredictable it is, the more effective your program will be. Allow the subject's behavioral stability to prompt when your next change should occur, and what your overall goal should be. And finally, let the data guide your decision when to move on to the next criterion. That's a really important piece of this puzzle. All right, have a good day.